Welcome to Svast's presentation, Increasing Revenue with Value-Based Care. My name is Cindy Courtney, and I will be your presenter today. I am here to talk about how adding value-based care services to your current practice or patient workflow can also increase your revenue. As you can see, value-based care encompasses several different population health models that were created by the Centers for Medicare and Medicaid Services to offset the burden of non-face-to-face patient care. Chronic care management is geared toward the primary care providers. In order to meet the eligibility criteria, the patient must have 2 or more chronic conditions that are expected to last more than 12 months or until death. Steps to meeting the criteria to code for chronic care management include obtaining the patient's consent, creating a personalized care plan, communication with the patient, and documentation of at least 20 minutes of care coordination during the month. The documentation includes an ongoing review of the patient's status and management of the diagnoses, referrals, and prescriptions. Providers who are eligible to bill for E&M codes are also eligible to bill for CCM. Principal care management, on the other hand, is geared towards specialists. With PCM, patients are eligible if they have a complex chronic condition expected to last at least 3 months, and it puts the patient at risk for hospitalization, acute exacerbation, or functional decline. Like chronic care management, you must obtain the patient's consent and have a personalized care plan. The documentation and billing providers remain the same. Transitional care management can be coded by both primary care providers and specialists. In order to meet the criteria for coding transitional care management, the practice needs to contact patients within 48 hours of discharge from a facility and have a follow-up appointment with a provider within 7 days for a high medical decision-making diagnosis, or within 14 days for a moderate medical decision-making diagnosis. Advanced care planning can also be coded by both primary care providers and specialists. When there is a conversation about end-of-life decisions, or you or your staff are assisting in filling out paperwork for the same, these codes should be applied to your visit. Remote patient monitoring is the newest telehealth offering to patients. It allows patients to use mobile medical devices and technology to gather patient-generated health data and send it to the provider for management of chronic conditions. The most common devices include scales for monitoring weight in the congestive heart patient, pulse oximeters to monitor COPD, glucometers to monitor diabetes, and BP cuffs to monitor uncontrollable hypertension. Patients even have the opportunity to use their own wearables, such as smart watches and smart patches. The patient just needs to have a qualifying diagnosis to participate. Here I have included a guide for coding the population health models discussed in this presentation. Note here that chronic care management and principal care management are billed at the end of each qualifying month and cannot have an E&M associated with the claim. The transitional care model can be billed with an E&M code if you are discussing a separate issue other than the admitting or discharging diagnoses at the office visit. And advanced care planning can be billed with or without an E&M code. So how do you manage to accomplish the extra work? A care coordinator is ideal. The care coordinator will have time to complete and follow through with a patient's personalized care plan while accurately monitoring the time spent for coding. But you can manage with your current staff until your program becomes robust and the need for a full time care coordinator is there. Your staff are already doing a vast majority of these tasks. Why not take the extra few steps needed to code and be reimbursed for your time? This brings us to the end of our presentation. Please make note that the Svast team can assist you with all aspects of setting up and launching value-based care in your practice. If you are interested, please reach out to your CSE for additional information. Thank you and have a great day.